Yesterday we have learnt about the primary effects of hot and cold, which could be much relevant for the treatment of bronchial asthma. Do you remember that? We have learnt about the excitant effect of the hot application as a primary effect and depressant effect of cold application as primary effect. But later we came to know that cold is a vital tonic as a secondary effect and heat is a depressant as a secondary effect. So, preferably we need to give primarily hot application and secondarily cold application for the hydriatic management of the asthma. So, we have classified the asthma into mild, moderate and severe type of asthma depending upon the clinical features. So, we have remembered about the last class where we have classified it into mild, moderate and severe depending upon the symptoms of attack. So, in mild there will be less than 2 per week and in moderate there will be more than 2 per week and minimum of 4 symptoms, 4 episodes of asthma in a month, and in severe there will be continuous asthma attack. That is what we have to remember today. So, coming to the hydriatic management of asthma, and here also we have a separate set of treatment for mild form of asthma, moderate form of asthma as well as severe form of bronchial asthma. So, in mild form of bronchial asthma, we go for different applications like cold chest pack, which can be repeated by every 6 hours. What is chest pack? It is just wrapping cold towel which is dipped in the cold water around the chest region. That is what is called as cold chest pack. So, cold chest pack which is repeated by every 6 hours, then sipping of hot water, then throat gargling or gargling with the hot water. It is also called as throat irrigation. Then neutral bath at bedtime, copious water drinking, preferably hot water drinking, then correcting any existent gastric disturbances. You know that GERD, that means gastroesophageal reflux, that is also one of the cause for the asthma. That is why you have to correct any existence gastric disturbances. Then also if there is any nasal blockage, you can go for steam inhalation to avoid the mouth breathing. That is how you mainly treat the mild form of asthma. So, all these are mainly giving you the symptomatic relief in asthma attack. Coming to the moderate form of bronchial asthma, the management of moderate form of bronchial asthma. So, here you have to go for neutral chest pack, enema every day at least for 2 or 3 times in a week, then graduated cold baths, then sweating procedures like steam bath, sauna bath to make the skin active, because in moderate there are pathological changes which is already taken place in the body, especially in the lung, resulting in the breathlessness. So, you have to remove the mucus plug and you have to correct the air passage. So, you have to go for neutral chest pack, enema, graduated cold bath. So, preferably you have to make the person to keep himself exposed to cold. So, we have to go for graduated cold baths. How the graduated cold baths are given? That is by decreasing the temperature of the cold water by subsequent applications of cold. So, that is what is called as graduated cold baths. Steam bath, of course, exposing the body to the steam. Sauna, exposing the body to dry hot air, that is called as sauna. So, all these are for moderate type of bronchial asthma. Irrespective of mild and moderate, where there is more of cough, you can go for copious hot water drinking, fermentation to the chest every 2 hours. How do you give fermentation? By using the fermentation bags. So, fermentation to the chest every 2 hours, followed by heating compress, sometimes continuous hot application is also not advisable. That is why you have to go for heating compress. What is heating compress? Once again, just dipping the cloth in the cold water and wringing it very dry and applying around the body, that is called as heating compress. So, after wrapping the cold cloth, you are also covering the body with the impervious material. So, that is called as heating compress. So, body will be having heating effect. Okay. So, fermentation to the chest every 2 hours followed by the heating compress. Then going to revulsive compress, where there is alternate hot and cold application, hot for 4 minutes and cold for 1 minute. So, it is a revulsive compress. Then even you can go for drainage of the sputum by drainage method, that is by going for tapping method, where the sputum will be drained off from the lungs. So, this is how the expectoration or the cough can be treated in both mild and moderate. So, coming to the severe condition of the asthma, we are going for cold fan douche to the back. Here fan douche means a douche which is applied at less pressure, which is spread like a fan. Okay. So, because of the spreading of the water column, there will be less pressure. So, cold fan douche to the back or to the chest, followed by heating chest pack, revulsive compress to the chest, then alternate douche to the legs, because you know that soles and palms are the reflex areas for the lungs. So, you can give application to the palms as well as soles. So, there will be alternate douche. Alternate douche means hot douche once and cold douche once. So, together if you are giving for 5 minutes, then it is called as alternate douche. It is also called by another name called as Scotch douche. So, you can go for Scotch douche to the legs, hot foot bath or hot leg bath, then hot enema, hot arm bath, then sweating pack, hip pack and wet girdle pack. Wet girdle pack means what? You have to cover the trunk with the wet cloth, that is called as wet girdle pack. So, all these treatments can be given in chronic conditions. So, cold fan douche, revulsive compress to chest, Scotch douche to legs, hot foot or hot leg bath, hot enema, sweating pack, hot hip pack, then wet girdle pack are the management of asthma in chronic condition. If there is any asthma attack, what are all the home remedies you can ask the person to take? So, during the attack, you have to ask the person to go for hot water drinking, facial steam, hot fermentation, hot foot immersion and hot chest pack. All these should be given together, that is very important. So, you have to ask the person to have hot chest pack, over that hot fermentation, hot water drinking, then facial steam and hot foot immersion. All of these together, whenever it is given for 10 to 15 minutes, then person can breathe easily. So, his asthma attack can be overcome. So, during the acute condition of asthma, you can go for all these home remedies. It is easy to practice. So, all these home remedies can be given together. So, 5 treatments together can be taken by the person. So, that is about the treatment of the asthma. Now, coming to the prevention of asthma, how do you prevent the asthma by hydrotherapy? It is by cold chest pack, nasal irrigation, neutral arm bath, neutral foot bath, hot water drinking, facial steam, throat irrigation, cold bath, wet girdle pack, rectal irrigation, graduated bath, and also by practicing swimming you can prevent the asthma. So, here cold chest pack means it is already told, it is packed to the chest. Nasal irrigation, keeping water through a nasal pot, that is called as nasal irrigation. Neutral arm bath and neutral foot bath, where arm and feet are being immersed in the water. Hot water drinking, you know about it. Facial steam, just taking steam with the steam inhaler. Then throat irrigation, once again gargling. Cold bath, which is very much known to you because you take bath in different temperatures of water. So, if you are taking in cold temperature, then it is called as cold bath. Then cold wet girdle pack, as I already told you, it is covering the trunk and chest with the cold cloth. Then rectal irrigation, that is nothing but enema. Then graduated bath, where in subsequent application of cold water, you are going on reducing the temperature of the water. That is what is called as graduated bath. Then swimming, of course, there are different styles of swimming, and according to the person's capacity, he can go for swimming procedures. So, that is what different applications which can be there for the preventing the asthma. So, there are different evidences which we can talk about, where there is one published paper authored by Dr. Shirley Tellis and Dr. Manjunath, which is published in World Journal Medical Sciences about the with the title Therapeutic Application of Cold Chest Pack in Bronchial Asthma. It concludes that an application of cold chest pack increased the peak flow meter rate as an immediate effect, and the effect is augmented following 21 days of other naturopathy treatments along with yoga. So, the peak flow meter rate, that means PFR, it can be increased by cold chest pack. It is already proven. Then another paper which is published in Indian Journal of Physiology and Pharmacology by Chittaranjan Vairao et al. Conclude that significant increase in forced vital capacity and forced expiratory volume from the date of admission up to 6 months can be seen by the yoga techniques and naturopathy techniques. Then maximum voluntary ventilation significantly increased from admission till the date of discharge. They said that it is for the 10 days of treatment. Then peak expiratory flow rate significantly increased from admission till the 36th month of follow-up. So, there is a follow-up study which says that naturopathy and yoga, it helps in bronchial asthma. And a scientific evidence based on the effects of hydrotherapy on various systems of body, authored by Dr. Muventan and Dr. L. Nivedita, which is published in Northern American Journal Medical Sciences in 2014, it concludes that there is significant increase in the tidal volume of the lung in cold or hot water compared to neutral water. So, all these evidences, they help us to plan for a particular treatment in the asthma management. Thank you.